believe, in my opinion, the work that we do at Safe Communities is important because we are here trying to save lives.
Safe Communities' mission is to be able to save lives, prevent injuries, and make our community safer. They do that through pedestrian safety, through drug awareness and drug prevention campaigns, through suicide awareness and suicide prevention campaigns, fall risk.
The work that Safe Communities does is so important because they're really addressing the most pressing needs in our community in terms of injury prevention and also what will keep people safe.
Nobody actually pulls together partners in the way that Safe Communities does.
I think that the collaborations that Safe Community has makes that organization more stronger. Being able to collaborate with more than 300 different organizations speaks loud about what Safe Community does.
I think sometimes, we go about our lives and we go about our days and we don't think about the things that maybe could be changed and really could make us safer.
Safe Communities employs people with lived experience to do the work. That lived experience cannot be underestimated because the people who have those lived experience actually know what's happening in the community.
I support and advocate for people struggling with addictions in the community, in the jails, and I give them support and try to walk with them on a path of recovery.
When we look at the opioid crisis, drug overdoses, Safe Communities not only works with us by providing the medical prescription drop boxes that get a lot of those drugs out of people's homes and away from people so family members or anybody else can't access those. It's saving our water supply by not having people flush those down the toilet, by not putting those drugs in landfills.
One of the things I'm most proud of is that at UW Health we launched an addiction prevention program, and Safe Communities helped us figure out that model, including peer support for opioid use disorder and how to staff that model together.
When we think about getting older, as we all are or are going to do, I think there is that fear of falling, and I think once you do fall, then you are even more afraid. But I think the tips and the things that we talk about in addition to the exercise program, I think are so valuable.
And it's just very fulfilling to know that somebody was listening and, actually got something out of this class.
Safe Communities, through their traffic safety, their pedestrian safety campaigns, they make sure that we enhance and improve the safety and the messaging to our community to make sure everyone in our community is safe.
I think, speaking of suicide prevention, if we know that an organization like Safe Community exists, it could save that life. Safe Communities is there for everybody.
So Safe Communities follow the data, and the data leads us to where the work needs to happen. But we know that the data just can't stand alone, so cultural context also plays a part because these are real lives that are being impacted by some of these issues, and we can't forget those real lives.
I meet you where you're at, but I don't leave you there.
I think at the heart of the work that Safe Communities does, it's partnership. It's being a facilitator and bringing people together to make a difference and improve health and improve outcomes in our community.
Safe Communities is here for you 24/7. We're just a phone call away. We are problem solvers.